Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Welcome to Five to Thrive Live, a podcast about thriving for those who have been affected by cancer and chronic disease. I'm Dr. Lisa Schuler, and I co-host with my good friend Carolyn Gazella. You can find all of our past show podcasts on any major podcast outlet and a schedule of our shows on ithriveplan.com. And tonight, I will be talking with my naturopathic colleague, Dr. Katie Stage, about ways to boost libido in women. Now, who doesn't want to hear about that? So Dr. Stage is a naturopathic physician, registered herbalist, and fellow of the American Board of Naturopathic Gastroenterology. She is a professor and maintains a busy practice at the Sonoran University of Health Sciences. Dr. Stage graduated with high honors from the Sonoran University of Health Sciences and then completed a residency at Sonoran University Medical Center. She serves as director of the Therapeutics Division and interim chair of the Physical Medicine and Homeopathy departments, and she is also a member of the Rick Scalzo Botanical Research Institute. And she is beloved by her students and colleagues alike. So we'll get to Dr. Stage in a moment, but before we start our conversation, I want to thank our sponsors. First, Cetria, which is a patented form of glutathione clinically proven to raise blood glutathione levels. Glutathione is the master antioxidant and the body's primary defense against free radicals. It also helps to support respiratory health, and you can learn more at cetriaglutathione.com. We also thank ProThrivers Wellness Supplements, including ProThrivers Wellness Brain, which is a product specifically designed for thrivers that contains cognizin for memory, focus, and attention, as well as other brain-supporting nutrients and herbs. And you can find ProThrivers Wellness Brain online at pureformulas.com. And finally, Dr. Ohhira's Probiotics, a best-selling probiotic for over 30 years, contains 12 probiotic strains, which are shelf-stable without refrigeration due to a unique 3-year fermentation process. And you can learn more at drohhiraprobiotics.com. Hello, Dr. Stage. Welcome to Five to Thrive Live.
Thank you so much for having me.
Absolutely. My pleasure. Well, I am excited to talk about this topic. You know, we've had a few shows in the past, not for a while, on libido, but they've been more focused on, I would say, sort of the behavioral side of things. So I'm excited to talk about this with you because I think you're going to give us a lot more in terms of strategies for this and ways to think about this. So let's just first start with how common, this is a big question because you're generalizing across the whole age spectrum, but how common is low libido in women?
It is a big question, and it's a tricky one to answer because it's probably underreported. And in truth, this really hasn't been tracked in journals and studies much until very recently. But certainly the answer is more common than people think. And some of the newer research is showing that, maybe 25% of women before menopause are reporting low libido at some point in their life, and about half of women menopause, and certainly seems to get higher the older we get. So a pretty significant number of people are affected by this.
It's interesting too, because I think it's important to really clarify what we mean by libido, specifically in this context, as we distinguish libido from desire, arousal. These are all terms that are in the medical literature around this topic. And I think sometimes they're used interchangeably, but really they do mean different things. So can you help us define libido, desire, arousal, and just kind of give us a bit more clarity around what this is all about?
Absolutely. And the language is confusing a little bit. And so it's nice that there are some words, but in truth, it's not an easy thing to define, right? Because these are in some ways intensely individual experiences that people are having. But generally speaking, libido, we can say, refers to our sex drive or our interest in engaging in intimacy or sexual intimacy. And, then there's arousal, and arousal is more a physical response. And so, when somebody starts thinking about intimacy, we get some physical signs in most people, right? Your heart rate might rise a little bit. You might get some sensations of warmth or tingling. And so those are arousal. They're more the physical sensations. And then there's desire. And desire is more kind of mental, emotional. So, wanting to explore something more intimate with somebody. And they're all interrelated, right? So for some people, arousal might come first. They might suddenly have a physical sensation and then desire follows. In some people, desire may come first, then arousal. It certainly changes. And so any way that you get there is fine. And sometimes that's an important thing when we're navigating this. Sometimes people assume that they have low libido because, they have some arousal, but that desire isn't always there as much as they want. And that's something that we can work on, but it's not necessarily wrong to have one or more pathway to get to that final piece of intimacy.
Yeah, I think that's just really important. And it's good that you are normalizing this for us, because I think that's part of the reason this is still considered a little bit, what should we say? It's still not talked about as often or as much as it should. And I think this is part of it. I read a book. I'm just looking for the title because I'd heard about it, and it's going to take me a minute to find it. I'll come back to this, but it's just a wonderful book that really helps to normalize what you just said. Like, there's lots of paths to the mountaintop, so to speak. It's all normal, and there's no right way or wrong way. And that's just a really important message. So I'll look for that title. In the meantime, let me ask you another question. So there is, when we're talking about desire, there's spontaneous desire, which you sort of alluded to a moment ago, and then there's responsive desire. And why does that distinction matter, particularly for couples?
Yeah, I think it matters because responsive desire is more when, there's some signal, right? Someone becomes aroused, and now suddenly you're more interested in sex or intimacy, we should say. And I think people have so many conceptions about what's right and what's wrong, what's okay and what's not okay, that oftentimes, I think especially women, since we're particularly talking about women here, might feel like there's something wrong with them because they have more responsive desire, but they're not really having spontaneous desire, meaning they're suddenly fantasizing about their loved person while like washing dishes or in a meeting. And again, that's okay. We go through these phases in life when we can have different expectations than maybe we were raised with. And so as long as we get to the top of the mountain, as you said, it's okay. And I think the important thing is that both partners or the partners that are involved can just talk that through and understand that. So, if one partner is kind of feeling like, well, how come my wife isn't just fantasizing about me while washing dishes? We can help people understand that responsive desire is also desire. It doesn't mean there's anything less special about the relationship. And, in particular, people that experience more responsive desire may do better if we can build some time in for physical touch or physical contact. So, you really are able to kind of build on that arousal, that stimulating desire for them.
Yeah. Okay, good. So if partner, I think this whole issue is additionally complicated by the fact that people have their own kind of maybe constant or varying issues with libido, desire, arousal, and then their partners might have their own issues. And then you have these two people that have to sort of navigate this together. So there can be this libido discrepancy. And how should partners navigate that? What advice do you give your patients, to do that, have that conversation without feeling shame or feeling frustrated?
Yeah, this is tricky when, the partners have different kind of expectations or wishes as far as the frequency of sexual intimacy. And so I think communication is always key, and it can be so hard for people to talk about this. it can be hard for people to talk about this with their provider too. A lot of people were raised just not talking about intimacy or sex, and it's a pretty vulnerable place to put yourself. And it's not easy to be vulnerable in the world. And yet, when we allow ourselves that time with a partner to be vulnerable, we can also often get to places that we wouldn't have reached otherwise. And so communication, certainly working with kind of, I feel this way when this happens, instead of like, I don't like that, tends to go better with communication. So really moving towards the way that you feel, which comes across as much less judgmental than, this isn't good or that isn't good. Sometimes compromise, right? When we're in relationships, there's a lot of compromise. And so that may be the case for some couples where, maybe we find a spot in between and we work on that. For some partners, scheduling some time can work really well. And for some people, this seems like maybe not spontaneous or, exciting, but the truth is, for many people, they're living busy lives, especially for my patients that maybe are more type A, just doing a lot of things. It's helpful for them to just have a set time, particularly private time, if there's kids where you can have a babysitter or lock the door or whatever, and that's just your time to be with your partner. So for many people, that is really key. Sometimes what helps is doing other things. So if we're at a place where there's some difficulty with, that physical closeness or intimacy, maybe you pick something else that you enjoy, go bowling or go on a hike or whatever. And that time together sometimes opens up some desire that wasn't as obvious before that. For some people, it's things like reading romantic novels or watching movies or trying something new with toys. And for some people, honestly, masturbation can be helpful, right? Either the person that is interested in more sexual intimacy, maybe just satisfying themselves, or sometimes the couple being together in the room can be a really successful strategy for couples. And certainly, if this is challenging to navigate, I can't recommend highly enough looking to psychotherapy or couples therapy. It's really helpful in cases where it's difficult to find the words or there's some emotional charge. Sometimes it's helpful to have somebody else in the room to help couples navigate that.
Yeah, really good advice. And I think that's also just normalizing all this. So the book that I was trying to remember is called Come As You Are by Emily Nagoski. Have you read that book by chance?
Mm-mm.
Oh, so good.
Good title.
Come As You Are. I know, right? Great title, but you and she align in your kind of how you're talking about things. So might be something for listeners and you to take a peek at. Okay, so back to our conversation. There are definitely physiological issues that can also be underlying some libido or arousal, certainly. Things, and of course there's psychological factors. What do you see as, I'm just doing this to you again, asking you to generalize, but what do you see as the most common ones that contribute to diminished libido in women?
Yeah, so from the more physical side, which of course it's hard to separate physical, emotional, spiritual, but if we start on the physical side, the first thing that I always want to think about, in particular with my women, is it painful, right? Nobody really likes doing stuff that hurts. And so if sex is painful or they're not able to climax, these are things that as a physician, I can work on with the patient. We can solve that puzzle. And sometimes that was the thing that needed to be done. So looking at that, we do have certain medications that can decrease libido. And these are pretty commonly prescribed medications. Our antidepressants, the SSRI group of medications, very commonly decreases libido. And this isn't to say, that people should just stop them. Obviously not. In many cases, these are life-saving, but it's a well-known side effect. And it's pretty unfortunate that some people feel like they have to choose to manage their mood disorder or having a libido, which certainly helps people feel more happy and fulfilled in life. So that's a biggie, but there's other things. Birth control pills can impact libido, some types of blood pressure medicines and others. And then we want to think about other medical conditions, cardiovascular disease can impact libido. And a lot of people don't realize that. But a lot of libido and climaxing is related to blood flow. And so if we're not getting a lot of blood to the genitalia, maybe we're not able to climax as well. And, this is what we call erectile dysfunction in men. Women don't have a cool name for it, but the same thing can happen. Poor blood flow due to plaque formation or other inflammatory factors can impact climaxing and thus libido. Also, conditions like diabetes or different types of neuralgias might impact sensitization to that part of the body. And again, those will impact ability to climax and libido. And just generalized pain. People are constantly in pain. It's hard to really feel like you want to have intimate time. It's just a struggle. And so we always want to look at those things. And then certainly we have hormones. Oftentimes this is the first place my patients, want to start at. Like, I don't have a libido. I like to take testosterone. So many people know that testosterone is related to libido. It's not the whole picture, certainly. And unfortunately, it doesn't help everybody, but it does help some people. We have other hormones too. So estrogen and progesterone do play a role in libido. We can see that demonstrated in changes in libido that particularly occur after menopause when we have those hormones fluctuating. Prolactin plays a role in libido. So someone who just had a baby and is breastfeeding generally does not have a strong libido. And, we think that that's kind of the body's response to maybe we need to wait a little bit before we get pregnant again. It took a lot of effort to grow that baby and to breastfeed them. So those hormones can play a role. And then we have some other hormones like oxytocin that also is made when we climax and is associated with feelings of closeness. And so that can also play a role. And we'll talk maybe later about some strategies to support those, outside of just giving people hormones. The other major hormone or thing to consider for libido, and I think many people know this, but stress. I mean, if I had to pick one word, it's stress, or we could say burnout or overwhelm. We all know what that feeling is. That is a libido crusher. And, the hormone most directly related to that is cortisol. When our cortisol is either very high or very low, we generally feel tired, we can get sick more easily, and libido is certainly impacted.
Yep, I think that's just really important for people to remember that low libido can be a sign that one's stress level is too high for good health. Not that libido, is the only sign or indicator of good health, but it is a sign, and it's a good kind of flag, if you will, to pay attention to whatever the stressors are and stress management techniques that are or are not in place. So speaking of techniques, let's transition a little bit and move into one of your areas of expertise, and that's kind of a naturopathic approach. And I'd love for you to also call out some herbal medicine that you found to be helpful, because I think this is something that at least in my practice, I found to be quite useful, although not very well known by a lot of people.
Absolutely. So herbs are one of my favorite ways to support libido. And of course, I love herbs just in general. It's fun there's a tactile element. And I think that it's nice to remember that being in the body, smelling things, looking at beautiful things has always been a way to support libido and enhance libido, throughout the ages. And sometimes we forget about that. We're so used to kind of a climate controlled, perfect environment, but smells, tastes, touches, textures, those can contribute. So working with the herbs and seeing the herbs are lovely. And one of the things I love the most about herbs is that they can address multiple things at once. So I can give an herb that supports libido and also helps decrease anxiety and helps energy and helps people feel more revitalized. And so I think that's really the beautiful aspect of integrative medicine or naturopathic medicine, that we're able to treat the whole person with this. So a couple of herbs to consider. One of my favorites to start out with is called Damiana. Botanical name is Turnera diffusa, but the old name was Turnera aphrodisiatica. So one of our most classic aphrodisiac herbs. And I think it works as an aphrodisiac as much because it just makes you feel great when you take it. Decreases anxiety, decreases depression, helps you feel energized. It's got a little bit of aromatic bitterness to it, which helps our digestion. It's just one of those herbs that invariably people taste it and they're like, wow, like I like this. We just at a medicine making event, we just made an elixir with that, and people were kind of surprised at how good they felt just trying it. So I love that because it's addressing some of the stress and mood related aspects of libido, and has a long history of use in enhancing libido.
Yeah, I love that you brought up. I just want to interject for a second. I love that you brought up Ternera, and just for the herbalists on the semi-herbalists or whatever on the call, that common name is Damiana. So some people might know
Damiana. Yes. Thank you so much. I get a little enthusiastic and I might just ramble on forever. So you tell me when to stop.
No, it's good. Good. Keep on.
Another herb I like a lot, in particular for women, is the common name is shatavari or shatavari, depending on how you want to say it. It's an Ayurvedic herb. The botanical name is Asparagus racemosus, and it's not like the asparagus we eat, but it's in that family. And this herb has been used for a long time in Ayurvedic medicine. In fact, the Sanskrit name sometimes is translated as like one who possesses 100 husbands. So, wow, you got to have a lot of energy to do that. And what I particularly like about shatavari is that it's moistening, or in Ayurvedic medicine, they call it unctuous. And so we notice, particularly after menopause, a lot of dryness in the tissue as estrogen decreases, and tissue all over the body, skin everywhere, but particularly, that vulvar vaginal tissue becomes thin and dry, and things just aren't very comfortable. And I find that shatavari, even when you take it by mouth, really helps kind of moisten the body. It's got a long history as an aphrodisiac, as well as a fertility tonic. It tastes pretty good. It's just a really lovely intervention to consider. Additionally, I like to think about herbs that can increase blood flow. We talked about how important blood flow is in arousal and climaxing and sensitization. So a couple of my favorites are ginkgo biloba. And of course, a lot of people know about ginkgo leaf because it's well known to support cognition, brain function, but it really is good at increasing circulation in small vessels around the body. And we have a lot of those in the genitalia. And so a little bit of ginkgo has been well studied for supporting libido and ability to climax. And in fact, ginkgo and saffron, which I know you did a talk recently on saffron, are two of the herbs that have actually been studied in people that have SSRI or antidepressant related low libido. And both have been found to help improve libido, even when people are on those SSRIs. So that's pretty cool. Mm-hmm. And of course, if you got the added benefit of feeling smarter and sharper, that's a wonderful thing.
Yeah. Okay. These are awesome herbs. So let me ask, do you, actually, I'm going to make a statement and then see if your experience is similar. So when I put together what I would call a libido enhancing herbal formula for people, I find that it works, but it takes a while. So my typical experience is that people will respond over several months, and it's a bit subtle. It's not like wham, they're like, wow, I'm a new woman. This is amazing. So it's subtle enough that they might come back, or on that 3-month mark or around there. And I inquire with them about their libido, and they're like, oh, yeah, it's much better. Oh, yeah, it is much better. Like, it's almost like it sort of sneaks up on them. But I'm just wondering what your experience has been.
Yeah, my experience is similar. I do think it takes some time, and I am usually giving these herbs on a daily basis. I want to get them into the body, kind of support some of those changes in mood and hormones and circulation. And then I often give an extra dose, if the patient knows they're going to be intimate, like, yeah, take a dose before then also. But it does take some time, and it can feel subtle. And I think it's also tricky for people to kind of quantify their libido. So when you're checking up on it, is that better? Sometimes they're kind of like, you said, like, yeah, I think so. And sometimes I'll say, okay, well, if that didn't work for you, we can stop, your botanicals. And oftentimes they're like, no, don't want to do that. So that tells me that something's working.
Right. And I think you mentioned this when you were talking about the herbs, but there's a lot of secondary benefits, so that the people's energy goes up. They're just their sense of what I call eudaimonic well-being. Their just innate sense of feeling better in life tends to improve as well with the libido, which is always a good thing. So in addition to these herbs, are there any other go-to strategies that you have?
Well, I think that exercise is really important. And a lot of people don't connect that to libido. But again, we're talking about blood flow. So anything we can do to increase circulation, particularly in the genitalia, but we're one closed system. So if we're increasing circulation in one part of the body, it's generally supporting other parts as well. So I love bringing exercise in. I'm a big fan of hydrotherapy, alternating hot and cold, maybe plunges, cold plunges in this case. Alternating with sauna therapy can be really helpful. And even when we think about traditionally, some of the words people talk or use in their language when they're talking about arousal and desire often relate to heat, feeling hot or warm, spicy. And so that tells us that somewhere deep inside, like we have this affinity or deep understanding that circulation is important here. I do lots of things. So we might, talk about counseling or psychosocial support. We might work on lubrication. Sometimes I joke with my patients that I sound like a lubricant commercial because I talk about it so much. But at the end of the day, we need a lot of moisture for things to feel comfortable. And why not try it, right? It's a safe, low-cost intervention. There's some fancy ones now that have different herbs added sometimes that can increase sensitization, feelings of warmth. This is fun stuff to play with for couples, I think. And then we have our fancier therapies that also can be considered if needed. For some people, some vaginal estrogen or testosterone can be really helpful. Some cases I've even used oxytocin, which has to be compounded and can really help in some situations with feelings of closeness. But there are free ways to make oxytocin. So just staring in someone's eyes for 2 minutes, which is a long time, actually, can start to stimulate oxytocin production. And even looking at pictures of babies and animals or the real thing, if that's available to you, can give yourself a little oxytocin boost as well.
Yeah, wonderful. Well, believe it or not, we're coming up to the end of our show. So I'd love to give you a chance just to share any final thoughts that you'd like to leave with our listeners on this topic.
I think the most important thing I would like you all to think about is if you feel like, libido is a problem, please talk to your provider about it. You're not alone, and there are lots of things that can help. And so what doesn't help is feeling bad or shameful about it. This is really common. Almost everybody experiences it, and there's lots of interventions that can help. And try some lubricants.
Yeah, you do sound like a lubricant commercial. Yeah, that's very good advice. I think you were we had Dr. Tori Hudson at Sonoran recently, and she told a funny story about a woman who was going from practitioner to practitioner for years, I think it was, trying to get help with her libido, and people were trying all sorts of things. And finally, somebody had the bright idea to ask her, well, how often does she want to have, or what is she looking for? Like, what is the actual problem? And then she explained that her partner wanted to have sex every day and she just wasn't up for it. So it was kind of funny, but it was also a good reminder to just also remember there is no normal. And it's really, I think what you're talking about today is what if you're feeling like your own libido isn't where you want it to be, then yes, I would agree. Talk to somebody, talk to a healthcare provider so you can get some good support.
Absolutely.
Okay. Well, Dr. Stage, thank you so much for joining us on 5 to Thrive Live. And thank you for this great show. Where can people find you?
So I work at Sonoran University. You can find us at sonoran.edu, or if you're a patient, you can do patients.sonoran.edu.
Perfect. Okay, well, that wraps up this episode of 5 to Thrive Live. We thank our sponsors again. First, ProThrivers Wellness Brain Formula. Then Cetria Glutathione, the superior glutathione to support liver and immune health. And finally, Dr. Ohhira's award-winning shelf-stable probiotic. Thank you, listeners, for joining us. May you experience joy, laughter, love, and libido. It's time to thrive, everyone. Have a great night.